Meeting to order. Invocation, pledge of allegiance, be led by Commissioner Page.
Let us pray. God, who is always present, we began this day with you. As the sun rises above the eastern horizon, so too our prayers and praises rise before you. As we journey throughout this day, help us to also end this day with you. May we know the consolation that same God who is present with us today will be with us tomorrow. So, we believe that tomorrow, as it is today, we will know God's presence is with us in all we do. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, first order of business is the minutes for the May 7th, 2020 meeting. Is there a motion to approve the minutes?
I move to approve the minutes.
Second.
All in favor, say aye.
Aye.
Motion carries. Bills, Commissioner Postal.
Start with accounts payable. Accounts payable total $643,717.52. Payroll account is $313,575.59. In the 911 account, payables are $3,933.91. There are 5 checks through the LEPC account for $2,431.57. And finally, there's 1 check in the liquid fuels account for $2,924.10. I make a motion to pay the bills.
I'll second that.
All those in favor, say aye.
Aye.
Motion carries. Treasury report.
Our beginning balance was $1,739,477.45. We had deposits of $885,373.38. We transferred $1,107.97 from LEPC. We agree with the reading of the bills by Commissioner Postal, leaving us an ending balance of $168,665.69. Our liquid fuels account has $385,899.69. Our Act 89 has $326,657.79. Our 911 has $671,845.89. Our LEPC has $37,340.63. Our local use fund has $427,927.04. And our capital reserve has $14,854,909.88. It's all subject to audit.
Thank you. The motion to accept the treasury report.
So moved.
Second.
All in favor, say aye.
Aye.
Motion carries. Meetings and events, Commissioner Postal.
All right, thank you. All these meetings were held virtually or by conference call. I had a meeting with Central County's Youth Detention Center. We had a call-in with Senators Toomey and Senator Casey to talk about federal legislation. I had a CEDACOG Natural Gas Executive Committee meeting. We had a CCAP Department of Health briefing with the responsibilities of moving to the yellow phase. We had a CCAP board meeting attended by Governor Wolf to explain his policies to the county commissioners. At a National Council of Counties call-in to discuss federal legislation, the DLI Executive Committee meeting. And we have various internal meetings all the commissioners attended relating to the Annex project, insurance coverage, pictometry, the correctional facility, and other departments. Thank you.
Thank you, Commissioner Page.
Yes, we had the internal departmental meetings, as Commissioner Postal said, also the Area Agency on Aging Board and the Solid Waste Authority Board.
Okay, and I have all the same internal meetings, and that's all I had. Public comment.
What I'd like to do is just take a minute to note that we've done this at past meetings, that it's important for our citizens to participate in the 2020 census, and everybody that has not self-responded yet, please do that. If you have not received anything in the mail, you will receive something at your residence. And to give you a little bit of numbers here, Pennsylvania has 62% self-responding. Mifflin County is actually doing better than the state at 63%. And the county is led by Menno, Union, and Brown Township at about 77%. So that is great for the Big Valley area. Some of the other precincts and census tracts are not doing as well. They're below the 50%. So let's get this done. The more that the more self-respondents we have, the less that the census needs to follow up at your resident. And it's important that we get a complete count. We're going to be going over some grants. Every meeting we go over grants. Some of these grants are a function of the population. If we don't count our population, that means these grants are not what they should be. So I just want to point that out, that the census is ongoing. You get this, please try to self-respond. Thank you.
Thank you. Any other public comment? Moving on, new business. Update from Phil Lucas, the Director of Emergency Management.
Morning, everyone. Just wanted to throw a little shout out to the staff in the 911 Center. This week is officially the National EMS Week, and the 911 Center is actually considered the first of the first responders, and our staff continues to work diligently to ensure the safety of our community and make sure our first responders are dispatched appropriately and timely. COVID-19. Currently, we continue to have several difficulties in dealing with the statistics that are being provided by the Department of Health due to timeliness and accuracy. Sometimes these numbers are provided 3 days after they're posted by the individual agencies. Other days, there's significant interpretation issues in how those numbers are provided to the public and even other levels of government. Just as a side note, the Department of Health actually had to postpone providing any numbers yesterday because they had a recognized error in how their data was being collected. So we're not sure how that's going to be fixed. The state website that deals with various postings of information is also showing numerous errors. So we're not sure if the system has crashed or if it was hacked or what the problem may be.
Well, they did actually post yesterday's numbers. They didn't post until like 7 o'clock last night.
Right, but the web pages themselves had errors. So I'm not sure if after they posted it, they found out because those errors were still present this morning. So working with the numbers from yesterday, Center County has 133 positive cases and 5 deaths. We think that's actually more. There are actually more deaths than they have posted. Huntington County has 215 with 1 death. Virginia County has 94 with 2 deaths. Mifflin has 57 cases with 1 death now, and we've not received any definitive information on that death yet. Yesterday afternoon, the coroner was investigating to try to verify, was that an actual resident, and any information associated with that. Haven't heard back. Snyder County has 33 cases and 1 death. Hospitals in the region, Center County has 6 cases in their hospital. None of those are on ventilators. Blair County has 9 cases in their hospitals, predominantly UPMC Altoona, with 7 of those on vents. Mifflin County has no cases reported. Side note for the Blair County, we believe the majority of those patients that are in the hospital are due to SCI Huntington. I'll mention that a little bit later. Of the 4,767 deaths reported as of yesterday, 3,172 of them are in nursing homes. 66% of the deaths in Pennsylvania are from nursing homes. Center County has 3 facilities, and due to the method that they're reporting numbers now, we believe there are more than 15 residents, but we don't know how many more, plus or minus. There are more than 10 employees with COVID-19 in Center County, and there are less than 10 deaths associated with the nursing homes. Huntington County now has one facility that has less than 5 employees infected. Mifflin County has 2 facilities with less than 5 residents and less than 5 employees. We believe these are the same numbers from previous weeks, and we suspect the resident and employee have recovered because it's been greater than 14 days. Actually, it's been almost a month since those first numbers were reported. Union County has 2 facilities with less than 10 residents, but we suspect that that's going to be a hot spot, and those numbers will be increasing in those 2 facilities. Prisons, these are state correctional institutions. Benner has 1 prisoner that tested positive. Rockview has 2 corrections officers. Huntington has 47 corrections officers and 155 prisoners who've tested positive, and 2 of those prisoners have reportedly died. And that lends to the discrepancy. Prisoners are counted by their prison where they're located in the county of death. Huntington County officially has 1 death, but we know there are 2 prisoners who died from the prison. So again, lots of discrepancies. One significant note, CDC did officially publish their Reopening America guidelines. It's about a 60-page document, has lots of tables. We hope that the state will be using this document to move forward with reopening Pennsylvania now that it's been officially published. One notable factor in that is the CDC is recommending a 14-day examination of positives along with other data to base what that current decision is. So currently Pennsylvania has a red, yellow, and green light system, but we don't know how often counties will be examined when they move from red to yellow or green. The state hasn't released any guidance on what will be required of counties in order to move to the green phase. This document from the Fed says every 14 days, as long as it's the statistics associated with positives and medical capabilities, they can use that to justify that movement up or down based on those conditions. So we're just waiting on Department of Health to actually publish what they're looking at and what time schedule they'll be doing that. We still continue to plan on social distancing of some sort through the summer, and media reports are showing various governments around the world are beginning to plan for resurgence of COVID-19 as part of the cold and flu season in the fall. So we are working on that through the task force with the region and the Regional Healthcare Coalition so that we can make sure our acute care facilities and non-acute care facilities such as nursing homes, home health care agencies, and those types of facilities are prepared and included in what the Department of Health is doing, because that's been one of the things we've noticed. Nursing homes were left out of a lot of initial planning response, and the Department of Health continues to not recognize or is just recognizing critical activities that need to be associated with the response with personal care homes and home health care agencies. We've also recently started discussing state facilities and state agencies that are not reporting to the Department of Health as part of the Department of Health. Those agencies have basically been ignored in the planning response and distribution of PPE across the state. Many counties have been supporting many state agencies that are not being provided, that provide care for individuals, but are not being addressed by the Department of Health. So many things are being recognized. A lot of those things are being planned so we can have a more cohesive and consistent response as we move forward.
I'll also point out that the Carnegie Mellon risk analysis was published, and anybody that's interested could get that on the governor's page. I believe there's a link to Governor Wolf's page or the Department of Health's page for what it's worth. You can see what the ranking is per county.
Okay, thanks, Phil. Okay, we have a request for exoneration of 2020 county portion per capita tax. The Granville Township Tax Collector Billy Weaver has 96. Newton Hamilton Borough Tax Collector Melody Kane has 2. Juniata Terrace Borough Tax Collector Jerry Dukes has 5. Union Township tax collector Herb Zook has 23, and Arma Township tax collector Linda Marks has 14. Is there a motion to approve the exoneration?
So moved.
Second.
All in favor, say aye.
Aye.
Motion carries. We have a request for exoneration of county real estate tax bill and relieve the tax collector from collecting this bill. It's a parcel located in Lewistown Borough. The house was removed from the parcel and will be rebuilt with the August supplemental billing at amount of $271.24. The motion to approve.
So moved.
Second.
All in favor, say aye.
Aye.
We have a request for a refund of a portion of the county real estate taxes. Parcel located in Armour Township, there was an error in calculation of square footage on the cabin. It's $202.67. Motion for the
So
refund.
moved.
Second.
All in favor, say aye.
Aye.
Motion carries. Amending the action taken on April 16, 2020 to exonerate Derry Township tax collector Brett Treaster from collecting 2020 county real estate tax bill. Corrected amount of tax to be exonerated, $1,644.02.
So moved.
Second.
All in favor, say aye.
Aye.
Motion carries. Rescinding action taken from the February 20th, 2020 meeting, accepting the offers on parcels numbers 1642-0048 and 1642-0072 in amount of $602 each. For motion to rescind.
So moved.
Second.
All in favor, say aye.
Aye.
We have a provider agreement and consulting service with Advanco International Incorporated out of Clifton, Virginia for the child accounting and profile systems CAPS for the period of July 1st, 2020 through June 30th, 2021 for a fee not to exceed $28,315.16. Dana.
So Avanco is a company that interfaces with the development and the implementation of our child welfare information systems, and CAPS, which is our child accounting profiles. And the regulations and the upgrades are developed through the Department of Human Services, Office of Children, Youth, and Pet Families, and they do our licensing.
Okay.
And this is a one-year contract.
Yes, it's amended every year.
Motion to approve.
So moved.
Second.
All in favor, say aye.
Aye.
Motion carries. Professional services agreement with Affordable Service Incorporated for CDBG lead-based paint risk assessments. Random asbestos testing for the period from May 21st, 2020 through May 20th, 2023. Mr. Marks.
Thank you, Board Commissioner. This was done on an RFQ process for the CDBG program for housing rehab and also other, if we do demolitions or that type of thing for our programs. We have to do the 3-year RFQ as required by CDBG regulations. It was reviewed by our office staff, and the recommendation was made by the to approve this to the commissioners. And the contract was reviewed by Solicitor Snook and also Mike Baker and approved by Steve. So my recommendation to enter into the contract for the Affordable Service.
Okay, thank you. Good motion to approve.
So moved.
Second. And this is just a question to Doug. This is a fixed price contract, correct? I'm looking at the rates. So these are the rates that are in the contract.
Yeah, they can vary per house depending upon what they need. For instance, if a house has a certain number of samples, like a large house may take more samples than a smaller house, that type of thing. So the price can vary that way. It is, like the risk assessment is set on a fixed fee basis, but like sampling, pre-sampling and post-sampling can alter the prices differently as far as like a per house basis. So for instance, if we had a very large house that's going to take more samples, that cost is going to be more than a 4-room house that we only have to take several samples there.
And the cost is paid through the program.
Yes, that's correct. Typically through the CDBG program or the home or the Act 137 programs where the funds come out of.
Okay, thank you.
All right, we have a motion, we have a second. All those in favor say aye.
Aye.
Motion carries.
Thank you.
Continuation of the Victim of Crime Act grant for the period October 1st, 2020 through September 30th, 2023 in the amount of $69. Lisa?
We receive this grant each year or 2-year period. The last grant was in a 2-year period. PCCD provides money to local county governments and nonprofits to provide direct services to victims and witnesses of crime. The plan is a continuation of services that have previously been provided in last year's plan, with the addition of legal services and peer support services. We received last year, or in 2018, a PCCD competitive VOCA grant, and that included legal services and the peer support. That grant ends September 1st or September 30th. This one starts October 1st. So this will pick up the expense of those 2 items to allow for continuation, but no other changes have been made.
And the total grant is $122,069.
No, I'm gonna give you a new number,
Okay.
189,063.
Over 3 years.
Over 3 years, yeah, it's 60,
That's
huh?
okay. We could do the.
63,000 each year.
Okay, thank you.
You're welcome.
Motion to approve.
So moved.
Second.
All those in favor say aye.
Aye.
Motion carries. Grant agreements for 2020 election security funds. Have the 2020 CARES Act, Pam?
The first, the HAVA Act is one that was passed as part of the Help America vote to make payments to states for activities to improve the administration of elections for federal office, including enhancement of technology and security. In March of this year, the Coronavirus Aid Relief and Economic Security Act was also passed, known as the CARES Act, to prevent, prepare for, and respond to COVID-19 for the 2020 federal election cycle. Pennsylvania is getting $15.1 million from the HAVA and $14.15 million from the CARES grant. Both of these require a 20% state match. Portions of both of these grants will be expended directly to the state for things, for statewide efforts for election security and technology enhancements for the counties and the state, training, education, and precinct protection kits, and more. $7 million of the HAVA funds and $6 million of the CARES funds are distributed to the counties on a formula-based process in regards to voter registration numbers as of April 13th. As a result of that, Mifflin County is entitled to receive $20,506.39 from the HAVA funds and $17,572.19 from the CARES funds. Allowable expenditures for the HAVA grant must occur between December 21st of 2019 and December 31st of 2022. Allowable expenditures for the CARES grant must occur between January 20th of this year and December 31st of this year. The HAVA funds are to be used for increased personnel, equipment, or other expenditures related to Act 77, an expansion of the provision and administration of election services, ransomware, DDoS protections, and other cybersecurity measures. Increased security of voting systems and ballots, and/or increased expenditures to expand and support vote by mail and other voter services. The CARES funds are to be used for the increased election expenses arising due to COVID-19, including but not limited to voter notifications and education, increased costs related to mail-in voting, supplies to mitigate the spread of COVID-19, and increased equipment, staffing, training, or other needs permissible under the grant. And both the funds from the grants will be done on a reimbursement basis.
Okay, thank you. Is there a motion to approve?
So moved.
Second.
All in favor, say aye.
Aye.
Motion carries.
And can you stay here a second? Yeah. Can we talk a little bit about the mail-in vote process, how many we've received, why it's important for people to mail them back as soon as possible, why the polls were combined?
So far, we have received over 3,000 mail-in applications, and almost 1,300 of those have been returned. So there's several that haven't been yet. The sooner to turn them in, the better. You don't have a chance of it getting lost in the mail. Plus, we're able to process them in a more timely manner. The deadline to turn in a mail-in application for a ballot is May 26th at 5 p.m. The deadline to turn in the ballot at the courthouse is June 2nd by 8 p.m.
Now, if you're going to mail in your ballot, you can't mail it on June 2nd. It's not the postmark.
Right.
Correct.
It has to be received at the courthouse by 8 p.m. June 2nd.
So it has to be mailed prior to June 2nd or hand delivered.
And only the voter can hand deliver their ballot. You cannot bring in somebody else's ballot.
Can you clarify one more thing, because we're getting calls on this? People are getting applications for mail-in ballots. And can you clarify that we are not sending those applications?
Right, so there are groups out there and political parties that have been sending out mail-in ballot applications, confusing voters and thinking that they are getting ballots or multiple chances to get a ballot, but we do not ever send out anything to a voter unless it's to verify their voter record or they have requested that we send it.
Okay, thank you.
Item K, resolution number 37, 2020, moving Dairy Township 2019 CDBG funds from Fish Park restroom project to housing rehab. Is there a motion to approve?
So moved.
I'll second.
All those in favor say aye.
Aye.
Motion carries.
Chastity wants to talk about that in a minute.
I was just coming if you had any questions.
All right, yeah, that's fine. You might as well stay there because you're up next anyhow.
Yes, I am.
Updated citizen participation plan line virtual meetings relating to the CDBG program.
So DCD and HUD have issued some waivers because of the coronavirus pandemic that we can have virtual meetings. We just have to update our citizen participation plan to indicate as such. And so we have thoroughly updated our citizen participation plan. Once this is approved, we will be able to begin our public hearings for the CDBG application process.
Okay, questions? Motion approved.
So moved.
Second.
All in favor, say aye.
Aye.
Motion carries.
Thank you.
Thank you. The communicable disease policy, Mr. Lucas.
As we're moving forward with opening more and more businesses in the county and the activities that various employees of Mifflin County are participating in at people's homes and interacting with clients, one of the items that was recognized was the fact that we need to ensure that our staff had adequate protections. The correctional facility in the past has a infection control policy, but really didn't cover all of the other employees that were outside of the correctional facility. So using a model from CCAP, we developed a recommended policy for courthouse employees, and we'll use that to support their activities and increase training and personal protective equipment for those agencies covered.
Any questions? Motion approved.
So moved.
I'll second that.
All those in favor say aye.
Aye.
Motion carries. Personnel. We have the hiring of Aaron Goss for part-time corrections officer effective June 1st, 2020. Hiring of Levi Bender for part-time corrections officer effective June 8th, 2020. And the resignation of children youth caseworker Rachel Hasteloff effective June 19th, 2020. Is there a motion to approve?
So moved.
Second.
All in favor say aye.
Aye.
Motion carries. No further business, we stand adjourned.